Hello everyone. I am Harshit Kanchav, Assistant Professor at Lloyd Institute of Management and Technology, and today we are going to explore an essential topic in medicinal chemistry, that is anti-adrenergic drugs. Whether you are a pharmacy student, a medical learner, or someone passionate about drug mechanism, understanding this class of drug is essential. Why? Because anti-adrenergic agents form the backbone of treatment for hypertension, arrhythmias, angina, and even some form of anxiety. They are everywhere, from beta blocker like propranolol that manages heart rate to alpha blocker like prazosin used in prostate disorder and blood pressure control. In this session, we will explore how these drugs work at receptor level, how they are classified based on selectivity and generation, the chemical synthesis of key drugs like tolazoline and propranolol, and finally, we will decode the structural activity relationship SAR that helps us understand how small changes in structure leads to big changes in function. By the end of this lecture, you will not only be able to classify and understand these drugs, but you will also be able to think critically about their design and application. So let's begin our journey into the world of anti-adrenergic drugs where chemistry meets clinical care. So let's begin with the basics. What are adrenergic antagonists? These are the drugs that block or antagonize the receptor action of adrenaline and similar compound. They function as competitive antagonists of alpha, beta, or both adrenergic receptors. Importantly, they differ from adrenergic neuron blocking agent, which acts by interfering the release of adrenergic neurotransmitters rather than blocking receptor directly. Let us first classify the alpha adrenergic blockers into three major categories. They are non-selective alpha blockers. They act on both alpha 1 and alpha 2 receptor. Example you see on your screen, that is phenoxybenzamine, phentolamine, and tolazoline. The next class is alpha 1 selective blockers. These drugs primarily block alpha 1 receptor, resulting in vasodilation and reduced blood pressure. The examples are prazosin and terazosin. Afterwards, the last category is alpha 2 selective blockers. They are relatively rare. Yohimbine is the main example. Blocking alpha 2 can increase norepinephrine release, sometimes used in erectile dysfunction or as a research tool. Physiological effect of alpha blockade includes decreased blood flow to viscera, increased mental activity and muscle strength, enhanced respiration and blood glucose level. So let us move towards the synthesis of tolazoline. Tolazoline is a non-selective alpha antagonist with notable antihypertensive properties. Structurally, it is an imidazoline derivative resembling imidazoline alpha 1 agonists like nefazoline and xylometazoline, but lacks the lipophilic group necessary for agonistic activity. It has stimulatory effect on GI smooth muscles, blocked by atropine, stimulatory gastric secretion via histamine release. The synthesis of tolazoline involves cyclization of phenylacetonitrile with ethylene diamine, forming the imidazoline ring structure. As you can see, the synthetic route of this drug, that is tolazoline, the starting material for this are phenylacetonitrile and ethylene diamine. Phenylacetonitrile provides the phenyl and nitrile groups, and ethylene diamine provides the diamine needed for ring formation. In the second step, nucleophilic attack is going on. The amino group of ethylene diamine attacks the nitrile carbon of phenylacetonitrile, forming an amidino intermediate, and then cyclization takes place. The second amino group then attack the intermediate, leading to cyclization and formation of imidazoline ring. The final product is tolazoline, an imidazoline derivative with a benzyl group attached to the second position of the ring. Now, if we are talking about the beta adrenergic blockers, which acts on the beta adrenergic receptor and block them. So, the classification of beta adrenergic antagonists are classified into three generations based on the receptor selectivity and additional effects. First generation have covered the non-selective beta antagonists, which blocks both beta 1 and beta 2 receptors. The examples are propranolol, metoprolol, timolol, sotalol, and pindolol. The second generation is beta 1 selective drugs. They have cardioselective properties preferred in patients with respiratory conditions, and their examples are metoprolol, atenolol, and esmolol. The next class or category is third generation drugs, which block both beta receptor and alpha receptors too, offering vasodilatory properties. The example of this category is labetalol and carbidiolol. So, if we broadly classify these alpha and beta receptor blockers, they have different action and biological function according to their selective receptor properties. So, moving forwards on the synthesis of propranolol, propranolol was one of the first beta blockers introduced, initially for angina pectoris and later found useful for arrhythmias and hypertension. The primary function is based on the blockage of beta 1 receptors, which present primarily in the heart. They causes decrease in heart rate by negative chronotropic effect, decrease in force of contraction by negative inotropic effect, and decrease in cardiac output. They also decrease renin release from the kidneys, and overall effect is to reduce the blood pressure and myocardial oxygen demand. Secondarily, they block beta 2 receptors, which mainly present in lungs, liver, and skeletal muscles. They causes bronchoconstriction and decrease in glycogenolysis and gluconeogenesis, which may cause hypoglycemia, especially in diabetes. They also reduce tremors due to beta blockage in skeletal muscles. If we are talking about the synthesis is done by using naphthol derivatives and epichlorhydrin, which forms a core structure typically of beta blockers. The aryl oxypropanolol propanolol mean skeletal. So the first step have etherification. The starting material is 1 naphthol or alpha naphthol. The reagent is epichlorhydrin. The phenolic hydroxyl group of 1 naphthol reacts with epichlorhydrin in the presence of base to form a epoxide ether intermediates, which forms 1 naphthyl oxy 2,3 epooxypropane. The second step includes amination. The epoxide intermediate is react with isopropylamine, a nucleophile. The ring opening of epoxide occurs at the less hindered position, introduce the beta amino alcohol structure. This results in formation of propranolol. The reaction summary is 1 naphthol is reacts with epichlorhydrin and epoxide intermediate form. This epoxide intermediate with finally react with isopropylamine to give propranolol. So now let's explore the structural activity relationship SAR of beta blockers. You clearly see the structure on your screen. Here, aryl group is attached with substituted amines by two carbon atom chain, that is ethylene bridge, across which we place a X atom. If this X is substituted by oxymethyl group, it gives the class that is aryl oxypropanolamine. If we replace this oxymethyl group by hydrogen atom, it gives aryl ethanolamine derivatives. So one by one, let's discuss about this substitution on this particular structure and find out the resulting effect on the activity of the compound. First one is aromatic ring substitution. The aryl groups defines beta 1 selectivity and influences absorption as well as metabolism. The oxymethylene bridge, which gives aryl oxypropanolamine, in which insertion of an ether bridge leads to activate beta blockers like propranolol and pronethalol. The side chain positioning when moving side chain around the aromatic ring affects potency and the selectivity of the compounds. Hydroxyl or halogen substitution. If we replace catechol group with chlorine, retain beta blocker activity. The example is dichloroisoprotenolol. The next substitution is on nitrogen. So, nitrogen substitution like tertiary butyl or isopropyl enhance beta blocking activity but can eliminate alpha activity. So, if we provide the bulkiness to the nitrogen atom, it will result in forming the beta blocking activities. Okay. The next is 2,3 carbon spacer. Essentially, for receptor binding, maintaining the right distance between amine and aromatic group is necessary. So here you see that aromatic ring and the amino moiety is basically separated by 2 to 3 carbon long chain. Lastly, mix alpha and beta activity. The compound like labetalol incorporate alpha affinity with additional structures towards. So SAR helps in rational drug design. Minor change in structures leads to a major change in action and side effects. So basically, this SAR gives an overall view that how the structure is resembled with the biological activity of the beta blockers. So to summarize this session, we say that we have covered adrenergic antagonists work by blocking alpha and beta receptors. Their selectivity determines their use in clinical conditions. We will review the synthesis of tolazoline and propranolol, and most importantly, we looked at SAR, that is structural activity relationship, the blueprint guiding the design of newer, safer, and more effective beta blockers. Thank you for joining me in today's lecture. I hope this gives you a clearer understanding of anti-adrenergic drugs, both in theory and practical applications. Thank you and have a nice day.